Washington Hospitality CEO Anthony Anton, who's going to discuss some of the things that have been going on with the governor's office in the last week and answer some of your questions today. If you have any questions, go ahead and throw them into the chat down at the bottom of your screen. We can answer them live. Also, thank you to our sponsors, Parker Smith and Feek. And with that, why don't we go ahead and get started, Anthony?
Well, thank you very, very much. And thanks to our sponsors and Lisa and the comm team getting us organized. I think the most positive thing we're going to say today is that it's 2021 and that blanking year is behind us. So even if everything doesn't go perfectly in 2021, at least we won't know it'll automatically go wrong. And so that's a positive. You know, since the last time we talked, there has been a load of news. The Triple P finally passed. The legislature is preparing to come into session. We got UI bills, and the average operator got an 800% increased sticker shock in their unemployment insurance. And vaccinations are now being distributed, but not really. And so there is a lot going on out there. And what I would love to do is answer any questions that come up today, but spend the first part of our conversation talking about approach. And I don't think there's any doubt right now that starting in mid-November, the approach of working with the governor's office is really not working. And the board and the executive committee and our team has spent hours trying to figure out, well, now what? How do we move forward? How do we get through this when we're in a mountain pass and one person is blocking the entryway and there's no way around it but this one person, and that's the governor. And so I'd like to review some of the things we're kicking around and we've been thinking about, and where we're at with those ideas. And then Lex, have a conversation with you. Please push me. You're a former operator. You've been a full service pizza guy and a quick service pizza guy and an owner, and you can only imagine the frustrations that people are feeling, like I am right now. I've never been more frustrated. I've never been more disillusioned. And then let's just open it up for questions. So if you're running a football team and you're a football coach and you know the run game is no longer working at halftime, you know you have to switch it up. And I really think that's where the industry is right now. We are where we are, and this governor is blocking the path. And I do believe that they believe until vaccinations are highly distributed, which the optimists would say March and the pessimists would say July, we're going to be close. And I think 25% is closed for our industry. You almost lose as much money other than employing people as you do being open for most operators. And so what do we do with that information? I think our response to the governor yesterday on his announcement and the new rules really reflected where we're at. We're frustrated. We're not happy. This is not good leadership. And yet here we are, just yelling at the wind doesn't do us any good. What are we gonna do differently? So I'll tell you about some of the things we're kicking around and we've talked about. I think a lot of people immediately want us to sue, and we are reviewing all our options. To my knowledge, I think the industry is looking or talking to 4 or 5 different law firms, and people are gathering information and looking at what can be done. And honestly, to date, a winning legal strategy hasn't emerged. That doesn't mean there won't be one, but before you spend $500,000 on a lawsuit and put a lot of relationships at risk, you want to make sure that you're doing something that is legally viable and has a chance to move forward. And so I know that research is being done, and I know that we are open to finding the right path for the right path to move forward. But again, at this point, we haven't seen that path move forward. And so we're hopeful with this new announcement to see what happens. I think there's some really interesting things that have come out of California on takings. And I'm really curious what the legal analysis says on that when that comes back. I think governor authority has been tested by, I think, 39 lawsuits so far, and they've all been thrown out. And so I think governor authority to this point has been pushed to its limit. But I think takings and or services not delivered are interesting legal approaches that might have more valid chance to move forward. The good news is the legislature is coming back into session, and that at least gives us another option. And I would encourage all of us now to move our conversations away from the governor's office. They are where they are, and really, what can we do with the legislature? The legislature starts here first part of the month, depending on when you're listening to this podcast. And there are going to be a lot of ideas out there, but one of the things they could do is say it's time to open us up or move forward. Ultimately, the governor would actually have to sign that bill, and so would he move that forward? But it could send a really strong message. So I think we are actively communicating with legislators and some other things to move that forward. And then the other one is just screw it, let's open. And I bet I hear that 7-8 times a day. I also hear from 3 or 4 operators saying we want to stay closed, so a day. And so there's a balance there in how united the industry will be in opening. But I do see local rebellions and operators holding each other accountable happening, and in communities from Spokane to Tri-Cities to maybe some of the Northwestern communities, I'm hearing these conversations grow, and it'll be really interesting to see how those progress. If I still had our family restaurants, I think the pro and con I have to weigh out is really my liquor license, because liquor licenses will be at risk, and there won't be a lot we can do to protect them. And that's the challenge on that. So the unity in local rebellions would have to be absolute to be effective. With the governor themselves, we're at a loggerhead. And it's a challenge. We absolutely believe our operations are safe. We absolutely believe the science is there with us. We absolutely believe that we were providing safe outlets, and that, when the governor closed restaurants and bowling alleys and everyone else on November 15th, we were at 1,500 cases. And on New Year's Eve, before the party started, we were at 4,200 cases. This approach isn't working. And we should be working together. That being said, that's not what the governor's office believes. And the governor's office believes something different. And that is a loggerhead. They clearly know our position. They clearly know they're putting thousands of more businesses at risk to the thousands that have already closed. And yet here we are. And so one of those other game plans has got to emerge as being more effective than our current one. Lex, you were an operator for a long time. You're also our communications director, so you've heard from many operators. Talk to me about, when I talk about that, how does that make you feel, putting your old pizza apron on?
Well, I think that business people deal with facts, because we're accountable for our taxes, we're accountable for our employees and payroll, and oftentimes the business owner is the last person to get paid. In fact, when I was running the restaurants, I was the last one to get a paycheck. And so facts are very important. And I think a lot of the things I hear from colleagues in the industry that they ask about is the data issue. One of the things that keeps coming up is, when will there be an accountability, whether it's through the courts or the governor's office, saying that the data that restaurants being closed contributes to the increasing cases, when in fact we've been pretty much closed most of the whole time. And so I think that there's a disconnect in the seeking of clarification from that angle. I think that there's a lot of frustration there. It's like, okay, well, there's more cases now, but you know what? You can't blame restaurants because we've been closed, right? So,
well, and I couldn't agree more with the operators, and I couldn't be more frustrated with the governor's office. You know, I listened to his press conference yesterday, Tuesday the 5th, on the drive home. And when he was talking about the numbers, I nearly drove off the road. I mean, I looked at the computer screen and it said 4,200 cases on New Year's Eve, and he said the numbers are proving us out. And we're in such different realities. It's beyond frustrating. It causes a lot of disillusionment.
yeah.
And yet, he's still the governor. He still has this authority. There's still no legal path to get around that authority and where we go. Now, trying not to get myself angry, I'll tell you what I hear back. And I don't believe the following things that I'm going to say, but this is what I hear back from the governor's office: is our contact tracing is incomplete. So yes, the contact tracing we do have shows that less than 1/2 of cases come from restaurants. However, we have less than 50% of the cases are contact tracing, and that other 50% could be coming from restaurants. And we know from national studies that restaurants without standards are a challenge. And so they are stuck on CDC studies, they're stuck on national studies, they're stuck on international studies, because they feel like what we've done in Washington doesn't have all the facts. I come back and say a 50% sampling of anything is better than any other proof you've ever used to make any other political decision. And we tell a different story in Washington because we've been great about 6-foot distancing. We've been great about watching our times and having no mingling rules. We've been a partner and we tell a different story. And yet that debate has us here, and they know it. There is no doubt in my mind that it's not like if the governor only knew. The governor knows. And yet here we are.
Well, I think Lisa, there's some questions that let's get some of those out of the way.
Yes, we do have a couple. The first one is the association going to do anything to defy the governor or defeat him at a later date?
So he just got reelected, so he's here for another 4 years, right? And this is his first session. So there hasn't been a 4-term governor. And my guess is, who knows? Politics is weird, but my guess is this is his last term as governor, not because of any electoral reason, but simply because at that point it'll have been a 3-term governor. And he would probably move on. So I'd be surprised if he would run again, period. We are reviewing all those things I just talked about. So if he's standing in the way, the only other options are local rebellion, legal, or legislative. And I just walked through those. And if there's a legal path that emerges that's viable, I think that'll be interesting to consider. And we are pursuing hard the legislative stuff right now. And I would encourage people to get involved in our talking to their legislator and going to the Legislative Action Center. In fact, Lisa, if you can put the Legislative Action Center in the chat, that's their starting point if they don't become an ambassador themselves. And then what can you do locally? I think those are conversations you can have. I think Pierce County and Tri-Cities have done a really compelling videos in their communities asking the governor to open them. I know there's 2 or 3 other communities that are doing that. And I think those are organic and local. And because of those 2 reasons, they're very effective. And I think the more we can partner locally with our association, our industry, chambers, and DMOs, and really build that grassroots pressure up, that's probably the next most effective thing.
Has anyone asked him about Costco being open and the massive breakouts that they've been having in the recent days?
The media asked him about that, and they are aware of that. It's one of my frustrations. I don't want to be the one to throw all the other industries under the bus, but I'm walking into grocery stores and watching people touch 10 pieces of fruit and put them back. The sanitation that when we started the crisis that was supposed to be at the front door is no longer at my local grocery store, and these things are happening. And I'm not trying to throw grocery under the bus, but how on earth is that more safe than what we're doing? What the governor says, and again, I'm not defending the governor because I'm as frustrated with his response as all of you, is at least they're wearing masks in those businesses, and restaurants don't have masks. And that has been his consistent reply of why do you keep picking on restaurants? And he keeps coming back to, because people are sitting down for 45 minutes without a mask on. I don't love that response. That response in our environments was 6-foot distancing and the servers wearing masks and the guests not mingling haven't proven to be risky. And yet that continues to be his response, which again is why we need to change the game plan.
One question is, can you explain exactly what the new Washington state start requirements are?
Because what I'm hearing in the question, Lisa, and if there's a follow-up, let me know. So I'm going to state the requirements. That being said, there really are 4 sections to what he announced yesterday: the new regions, the 2 phases, the new metrics, and the time frame of how long this new one is going to be in place. That's kind of what he announced yesterday. Phase 2, let me say this differently. Phase 1 stays exactly as is. So phase 1 is whatever you were doing today, you can do today. So outdoor dining, hotels, other stuff. If you were doing it on January 2nd, you can do it on January 11th. Phase 2 is where things changed, and functionally the only thing that changed is the 25%. And so he moved, if you meet 4 out of 4 metrics, you can now open at 25% capacity indoor. That is separate from whatever you can get outdoor, if outdoor is an option for you. I know not everyone has that option. But if you can get 20 tables outside in a parking lot, you can use 25% of your tables inside. The requirements for that 25% will be the exact same requirements we had in November. So 6-foot distancing, no mingling, all the other requirements that we were following, that at 50% we know we're working, will still be in place. Was there any other follow-up from the person in the chat room, or did that answer their question, Lisa?
There was
Actually, Anthony, I've got a follow-up on that, though. I believe that when the most recent round of restrictions were re-enabled in fall, that grocery stores and other similar facilities, malls and so forth, were also reduced down to 25%, correct?
Yes, and that's what they're doing. But they on January 3rd, they were 25%. They're still 25% in this new phase. Grocery
stores.
Yes.
I will tell you for a fact, I don't know if any other listeners, if you've been to Costco lately, I know it's a lot of square footage, but it does not feel like 25%. I go to Fred Meyer. So how is that enforced from an operator standpoint, thinking about, hey, look at that, they've got 25%. When the 25% comes my way, what are they going to do?
So I'm going to answer that question, but Lisa, I missed 2 other things on regulations. After I answer this, will you come back?
Mm-hmm.
I can tell you what's supposed to happen, Lex, but I'm as frustrated as you. We keep getting picked on, and yet no one's enforcing that. I have seen long lines at different places. We've seen outbreaks at different places, And I hate the whiny kid in class who excuses what they do because the other kid is doing it. But crap, if you're gonna punt, if these are the rules, then follow them. And if it's 25%, then follow them and put as much emphasis on everybody as you are on us. The answer of who's supposed to be doing that, that being said, is it's supposed to be the local health departments, and it's supposed to be on grocery stores and retail, be health department and L&I. And functionally, honestly, L&I just doesn't have a lot of staff. So the burden really falls on the health departments. And if the health departments aren't enforcing, then they're not.
And as an operator, I'm noticing in the chat that we're getting a lot of 25% references because they're thinking, kind of what I'm thinking here is when that 25% level is available in my region, I mean, what's really from stopping me to doing 50%? Not that we're openly encouraging that, but if you go to Costco or Fred Meyer, versus you go to Blazing Onion, it's what's going to stop you?
Yeah, it's, I'm so frustrated with the current situation. I don't even know how to answer that because I grew up with a rebel of a father, which is why he got into the industry, right? He got into it so no one else would have to tell him what to do. He wanted to run his own business. And I know damn well what he'd be doing now. And and I'd have to be saying, hey, your dad's doing this, why can't everybody else? And I get it, right? I know that would be happening. But I can tell you what the rules are. And the rules are 25%. Lisa, what I forgot to mention is two things did change. Closing time went back up to 11, and table sizes for outdoor did go up to 6 and indoor. So table sizes are at 6.
And can you explain when these regulations go into effect for reopening guidelines?
I can tell you what the metrics are, meaning how the metrics trigger. But until they've invented a new system here, and they've not disclosed how these systems have performed over the last 8 months. So I have no manner to do any projections or analysis right now because they created these regions. I don't have any ability until they release the data, which they're not going to do on Friday, to have a sense of how long we're going to be in these things. And that frustrates me as much as anything else. And a lot of is frustrating me right now. You have to meet 4 of 4 metrics in order to move from phase 1 to phase 4. The metrics, in a simple term, and I can go into details, are you have to have less than 90% of your ICU beds being used in your region. You have to have less than 10% positivity rate of tests being tested. You have to have on the epi tracking, not the counts tracking. On the epi tracking, your 7-day average has to be lower than it was 14 days ago by 10%. And that's both for counts, which is one of them, and the other is for hospitalizations. If you meet all 4 of those, you can move from phase 1 to phase 2. I know that the governor's office, because he said it on the press conference yesterday, is optimistic that one of the territories may hit that on the 11th. But Lisa, where I'm frustrated is I can't tell anyone right now how likely is that to hit, because these are new metrics and they're in new regions, and I don't know how they interact and I don't know how they performed. So my guess is when they come out on Friday, I'm going to spend 12 hours on Saturday trying to develop some kind of forecasting so I can give a better answer on that. So yet another weekend loss to this governor, and I know that's no sympathy to anyone here. We're all going through this.
Is there any conversation about going back to only allowing for same households at tables?
Phase 2 talks about limiting to 2 households per table. They know that's a difficult one to enforce, but they know that the rule followers will follow it, and that will reduce some exposure. And the health department estimates that about 70% of the public will follow a rule if they know it exists. And so there's no talk about going back to single households, but there is in this new rule 2 households per table, and then the table size is 6.
How is the health department monitoring restaurants? One of the questions is the local inspector last May said they wouldn't be back until this year. Where's the health officer? And the liquor officer said the same thing.
They're going by complaints. So honestly, it reminds me when you read about George Orwell's system of neighbors reporting on neighbors and people policing areas. It's the whole thing is so surreal, but roughly is it is based on complaints that spur the conversation. The problem is the Liquor Control Board is getting, I don't know, 7,000 complaints a week. And so the ability for them to respond to all the, by the way, I'm not 100% sure on that number, it's a memory. So their ability to respond to that many complaints is low. But at the end of the day, they are racking up complaints, and if a bunch of complaints come in, it's typically what triggers an inspection, and then the convenience of that. So I'll give an example of what happened to one of my family restaurants, before all this. But this example holds true. Is there was a tavern across the street from our restaurant that had a bunch of minor violations, and the Liquor Control Board went to inspect them. And because they were across the street, they went ahead and walked on across the street and inspected us as well. So my guess is if you're seeing an inspector, you've either had a high complaint or they were in the neighborhood, so they walked across the street and saw you too. Short of that, they are as overwhelmed as everything else. And in the more friendly health departments, we're hearing, I don't want to enforce this. But that is a health department by health department approach. So some health departments we're hearing, I get it, this is hard, I feel for you, this sucks. And other people are viewing this more as a power trip. So there's not a consistency between inspectors or health departments across the state as of yet.
One question is, the governor can veto any legislative bills. Can the legislature override those?
2/3, which when you have the same party governor, you might be able to get a bill through but the ability to override him is going to take 2/3 of the legislature, which is a really high bar, because roughly you're going to need half the people in the governor's own party to rule against him.
What region does the governor think will be open in phase 2 on the 11th? Do we know?
I don't remember if he said on the press conference. I'm trying to remember if he said it on the press conference. So I don't. I'm just gonna say I don't know, because honestly, even if he said it, I don't want to get anyone's hopes up, because the metrics still have 4 days to play out until Friday. So I wish I could give you a hard answer. They did hear absolute pushback from us of, look, telling us on a Friday and then we open on a Monday. If you tell us Friday at 3:00, I've already missed my Cisco US Foods order, right? Or whoever I order from. I'm not trying to take away from any of the other food companies. I mean, that I need to know that information Friday morning so I can get an order in, so I can schedule people for Monday. So 3 days notice is not the time we need. That being said, it is a Monday, which usually isn't our busiest day. So the governor's office heard that the idea that we'll flow back and forth between 1 and 2, and that we'll hear Friday afternoon about what's going to happen on Monday, is not okay with us. And there is recognition that that doesn't work for us, but not a care to act.
We do have one comment from the chat about Hill Climb this year, which will be virtual, and it's on January 25th for everybody who would like to register at hospitalityhillclimb.org. But the question about that is how can the public hear us if we do not show up in person?
You know, at some point we got to have some hope, right? Because we are stuck. But I would say I've actually been pleasantly surprised from the grassroots meetings I've seen to date. When you have 9 to 10 operators in a Zoom with a legislator, I almost feel like we have better communication. When you walk around and you walk into a legislator's office sometimes, and by the time you all get into the office and you all introduce yourself, you have about 3 minutes to get your verbiage out there, and then you're walking back out of the office again. So the Zoom meetings I've seen, I actually think are pretty effective. So I can't swear to that, but at some point it's the hand we're dealt. And, Lex says lemons into lemonade 24 times a day. And this is one of the times where I think he's right. I think it is what we have. And I do think there's a chance to work with it.
Is there any chance we could buy advertising to apply pressure on the government?
I think what the Tri-Cities and Pierce County Pierce County Chamber is doing is fascinating. And I think if your local operators and your local chambers and your local DMOs are creating videos, why wouldn't you buy a local cable package and get that out there? Absolutely. I could understand why someone would do it. If you haven't seen the Pierce County or Tri-Cities videos, I think they're both really well done. Lex, I don't know if there's a chance to drop those into the chat, or Lisa, but and I know other communities are looking at it, and I know those local communities are looking at buying packages to get that message out there. And I am hearing that both those videos have been seen by governor's staff and legislators.
One of the questions, Anthony, we're getting this regularly. How would you respond to operators who are asking, why can't we just challenge the legitimacy of the ruling? I know we addressed that a little earlier, but that is a recurring question that we receive. And doesn't he need the data to support the people to take the people out of business? And so how would you respond to those types of queries?
There's been 39 lawsuits challenging the governor's authority, and all 39 have been thrown out. Okay. And so, I feel like people have tested different angles of this. We were in conversations about the Michigan and Oregon lawsuits. We felt like they had a better set of facts than we did here in Washington. Those were done on the federal level. And even in Michigan with a Trump appointee judge, on the federal basis, that circus got thrown out as well. So again, I'm not saying no. What I am saying is we got to keep looking for the options, and we got to look for a path that can be successful. Being mad and screaming into the wind is not a good use of $500,000 if you're going to pursue a lawsuit.
Can you clarify the potential open dates? I'm reading it as the earliest we could open for indoor dining is at 25% would be after the results on January 22nd, assuming your area meets his metrics. Then that would be evaluated again on February 5th. And depending on your local results, you could have to immediately close again. Am I interpreting this correctly?
All right, I'm looking at my calendar. On January 8th, this Friday, they'll release the metrics. If you're in an area that meets all 4 of those metrics I mentioned, you're eligible to open on January 11th. Yes. If you then fail 2 of those 4 metrics on January 15th, you could be closed again on January 18th. That is a true statement. And that is this ping pong effect is one of the, I feel like my list is growing exponentially. It's one of the 1,000 things on my list that just doesn't make any sense to me. The idea that I would open I would get news on Friday afternoon to open on Monday. I'd have to schedule employees, bring them back, get their hopes up, order food, clean my restaurant, and then be potentially closed again the following Monday, but not know it till Friday afternoon after I've got everything. I mean, I can tell you what they tell me. They tell me these numbers will be stable and that they understand my concern, but the numbers are not going to ping pong that badly. But then they've not given me any numbers to analyze to ease that fear. And so they are clearly aware that I'm very concerned about ping ponging, and that ping ponging is more disastrous than anything else. They're clearly aware that, you know, your average restaurant has about $25,000 a month in full service restaurants in hard costs, and being open at 25% probably only means you have 18,000. You still lose 18,000 a month. So 25% does not work. So they're aware of all those things. And yet here we are.
Anthony, there's a clarification question or a clarification statement on the previous question about the governor's challenging the governor's authority. I guess not necessarily challenging the governor's authority, but challenging the data that supports his decision to isolate restaurants. What efforts have been put up in regards to that, or are there stuff that's in the works related to challenging the data that he's referencing?
We have, if we can do better, that's an absolute fair thing for us to consider. And so I'm not saying we've done it perfect, and I'm not saying we shouldn't do more. That being said, I'll say what has been done. We have had hours, like 16, 18 hours of conversation with staff, health department, the governor himself about our disagreement on the data. And so that has been challenged with the people in the room for many hours, and we're just at a standstill on what it means. We've had long conversations with most of the media outlets in the state saying, here is the 0.5%, and here is Washington data. And yet they keep referring to CDC data when half the states don't have a mask mandate, half the states don't have no mingling rules, half the states aren't doing the same. You got CDC regulations targeted at half the country that is nowhere near all the right things we're doing. And we've had that conversations with many media folks. I think some people would say, okay, you've had the media conversations, you have the governor's conversations. We maybe needed to go to a next level. I think that's a fair conversation when I say we need to have a new game plan. Our industry doesn't have a lot of dollars right now as far as just pure media buys, but I don't think we should take any options off the table either.
Is Hill Climb going to include a series of scheduled Zoom meetings with legislators?
My understanding is yes. If there's a GA person on the phone, they can confirm, but my understanding is yes.
All right. I think those are the questions we have. Give everybody a couple more minutes to type in any more questions you may have.
Is that both the Q&A and the chat room, Lisa?
Yes. Yes.
By the way, my text is blowing up, and so if you're trying to text me your question, please put in the chat, because it's hard for me to listen and check and read cell phones. I hate it when my kid does that, right? So I'm trying to be better. If you're sending me a text, please just put it in the chat.
Oh, here's one that we did get earlier. What data do we have on tribal casinos and restaurants on tribal land that are open?
Not much. I mean, if you've read the article in the Tribune a while back, the tribes have their own health departments and their own regulations in that front. And so contract tracing there would be based on those levels. I do know the tribes have done a lot of work to be safe, like we have. They've put in a lot of plexiglass. They put in a lot of stuff. I do know the governor's office has asked them to stay closed, and they've refused. And they do have the right to do so as being what's viewed as a sovereign government from their point of view. And so I also know that outside of the urban tribal casinos, I mean, they're down 70, 75% as well in many of their areas. And so we've heard actually a lot of support from the tribes saying, when you're down, we're down. When your hotels are down, when people don't feel safe to be in restaurants, and the governor's telling them don't go to these places, it has impact on them as well. So I don't have a lot of data on outbreaks from tribal casinos because of they have different systems. But at the same time, in regular conversations with the tribes, they want us open as much as we do, because beyond it's their community, they also believe it directly impacts their business.
In the metrics, how are hospital beds counted when it reads less than 90% of ICU beds? Is occupancy counted on actual beds or only on beds online? So if 50% of ICU beds are offline due to staffing, is the metric then based on under 40% of all rooms?
So I've had hours of conversations of what the heck is the ICU bed metric and what does it work before this announcement. Going back to the November time when they said ICU beds are the problem, I'm like, well, none of us want people to be in ICU in the street. Tell us the metrics, tell us where they come from. Because I got operators whose spouses are nurses and doctors who are saying their ICU rooms are empty. So I'm having a hard time reconciling why we can say we have to do this for ICU beds, and yet I'm getting these anecdotal reports from the field saying my local hospital is empty and has no problem with ICU beds. How does this reconcile? So I can tell you the response that I was given, and that's probably the most I have the expertise to respond to. It is self-reported by the hospitals, and the hospitals report those metrics to their local health department, which then report them back up to the state. I am aware that not all the hospitals are reporting in the exact same manner, and I'm not sure if these new metrics have brought consistency to that inconsistency.
And is there a website where we can find the info on whether our region is in phase 1 or phase 2?
There will be on Monday on Friday when it's posted. And this comm team, Lisa, Lex, and Jillian, I know will post that within minutes of coming up. So if you have not signed up for our text alert system, if someone can put in the chat room how to do so, you will receive a text, and if and also I'm sure an email the second that is posted. And it's going to be I will be reading it as live time as you'll be seeing it.
One thing that also important to mention is that there is a new regulations or new guidelines on PPP that we are expecting today. As an operator, it really pains me. When things were still open, I was talking to one of my favorite restaurants here in Olympia. We went to his place and he was struggling, and he was talking about how he's talking to his landlord. And I asked him, well, how much did you get for your PPP and EIDL? And he says, oh, we're still looking into that. It's a real shame because now he's out of business. And I think that if he would have gotten the PPP, because he said that $100,000 would have probably kept him afloat for another 6 months for his operation anyway. If you haven't already, definitely encourage you to look into the new round of PPP funding, and as well as EIDL. If you're in a low income area, there's a $10,000 grant that you would probably be eligible for, depending on the criteria of your area. And that is not even a loan. And so I really encourage operators to take advantage of those resources because they're being quite generous right now. So take advantage of that.
So Lex, just you are the lead. Are we going to be doing where can they get information? Are we doing a webinar later the month after the rules come out, or are we going to have? We're
going to have a webinar later with Rick Bra, who's our financial expert on a number of these things, who's also covered the PPP and EIDL on a number of occasions. He'll be talking about that later this month. But when the announcement comes later today, if it comes later today, we'll blast it out on social media. But I also want the team to spend some time analyzing that and working with the GA team so that we'll have a fully vetted story in the weekly email that goes out on Thursday. So that's kind of our plan right now, assuming it comes out today.
Well, I got to say, I spent 6 hours with Rick on New Year's Eve. So his wife's still mad at me because I was trying to figure out how to, I'm not sure she is. Colleen's really nice. Trying to figure out our fixed costs, triple P, how this all fits together. so I can understand the analysis and how to make recommendations. 3.5 times payroll on this one is a good deal. But not only that, also the employee tax credit on this one that can go back to last year. Get help on this one, because it's not the Restaurant Act. And yes, we would have rather had the Restaurant Act. That being said, it is a good deal. 3.5 times, 24 weeks. They fixed the tax rules. EIDL is in there. The employee tax credit is in there. Don't be passive on Triple P on this round of CARES Act. Lex, I think your advice is right on. I saw some more questions come by, but I wasn't fast enough to read them.
On marketing, it would be very helpful to have a social media campaign, having the facts and the impact of the situation on our industry spelled out. Her restaurants have had a long-standing policy of not posting anything political, as this can turn into social media nightmare. And in her community, anything posted in opposition to the governor turns into Republican versus Democrat, which isn't what this is about. And she said that it would be great to share industry messaging instead.
Great feedback. 2020 sucks. And so none of what 2020 was good, but one of the more positive things is the relationship between us and local chambers and local DMOs have never been stronger. And we really are united in trying to help this industry. And so we are working with your local chambers and your local DMOs. If you're not familiar with the term DMO, it's the same as a VCB or CVB. And you should be seeing some of the social media getting out through that. If you're not, ask your local and chamber and your local visitor convention bureau to start working with us, and we'll try to do a better job of getting it to them. Because I think where it's really seen, to your point, I didn't know what operators community was in, but if she's reposting something from her chamber and it's local and it's something we all know, it's going to have more impact. We've done a lot of research on what messaging moves people. State faceless organizations where they don't know the person are easily dismissed. Local chambers, local DMOs, local operators have about a 5-fold impact on impressions. And so that's why we're working so hard with locals, trying to get what we know statewide packaged and easy to digest at the local level so it can be promoted on the local level.
Will they get taxed on the PPP and EIDL?
The rules are in there, but my understanding, I wish I had my expert on here. Have Rick clarify on the when he does the PR. My understanding is no, that they fixed that. But I'm also not a tax expert. And honestly, I've been dealing with the governor's office about 14 hours a day for the past 3 weeks. And I've only had a chance to read summaries. I haven't had a chance to read the bill.
One attendee says they were told they qualified for the $10,000 grant and they would get it, but they never did. They got the EIDL instead. Or they did get the EIDL?
I don't know what the question is.
What I think what that is there are different qualifications on the first round of EIDLs because the SBA kind of went back and forth, and people who thought they were going to get $10,000 ended up getting $1,000 because it was based on head count, or they didn't get it at all. I think that there's a lot of things that are associated with that. So I do encourage you to maybe contact the SBA office, which I know is difficult as a business owner because you don't want to be on hold for 5 hours. But that's one of the things that I know. One of the things I also know, though, is this second round of EIDL, if you're in a low income, what they determine as a depressed neighborhood, which is fairly loosely termed, so I would look into that regulation, that it would not be based on headcount, that they would actually give the grants based on that. So I would look into that. And again, these are questions I'll forward to Rick Bra, and he'll be sure to talk about that when he does his webinar later.
And when is that scheduled for?
That's January 27th at 10 a.m.
Yeah.
I put registration in the chat.
And I also saw there are other resources out there. And I know that we're reposting this, right, Lex, in the hub. This gets every time we get a new PPP update or guidance.
Yeah, go to hub.wahospitality.org.
Yeah, maybe put that in the chat as well if someone didn't already. We want to be here for you. This is my one time a month where you get to call me names, ask me questions, hit me up. This is tough stuff, and I'd rather be transparent and take the hit. So we are doing this each month as a chance to be open and honest and take time out to make sure we're doing what you need. All right. Well, everyone, we are going to continue, and I know me personally, to work 14, 15 hours a day until we get to 50%. This sucks. This is not what we want. And yet I keep referring to Admiral Stockdale's paradox, right? We need to acknowledge where we are and what the facts are. And yet we got to believe we're going to prevail, and we got to keep fighting, and we got to keep moving. And that's what I commit to do. And we'll move forward from there. Everyone, happy 2021. I hope you are successful in securing PPP money by the time we talk again in February. Please sign up for the grassroots. Please get involved locally. Please contact your local chambers and ask them to support us and your local legislators. And thanks for everything you do, and thanks for making me so passionate about what you do. Everybody, have a good January.